Welcome to the Conversations About COVID seminar series. I'm Jessie Burke, Associate Dean for Academic Affairs and faculty in the Department of Behavioral and Community Health Sciences. It's hard to believe, but the semester is almost over, and this is our last Conversations About COVID seminar for the fall term. We've had a really great group of speakers over the past 3 months, and I encourage you to visit the Pitt Public Health COVID-19 webpage to review recordings of each. I also encourage you to share them with your friends, colleagues, families. It's a great set of recordings. As the pandemic continues to evolve, it's really important that we stay up to date on key topics, and I think these recordings provide a nice summary of some of those important topics. So the structure for today's session will be the same as it has been all along. Following my introductions, the speakers will present, and we'll open it up for questions from the audience. When we get to that portion, please use the Q&A function, and I will help to moderate the discussion. Please also note that we're recording this seminar. All right, so it's now my pleasure to introduce our guest speakers. Michael, I asked him how to pronounce his last name. Let's see if I can do it. Colaresi is our first speaker. He is the William S. Dietrich Chair of Political Science, Research and Academic Director at the Institute for Cyber Law Policy and a faculty affiliate in the Intelligent Systems program here at Pitt. His work leverages the accelerating availability of computational tools, including machine learning, along with unstructured information, such as that from digitized text, to build and improve models of dis and misinformation, propaganda, national security, secrecy and oversight, and international and intrastate violence and changes in the human rights over time. Our second speaker is Jaime Sidani. She's an assistant professor of medicine and a core faculty member in the Center for Behavioral Health, Media, and Technology at Pitt School of Medicine. As a trained educator, her research has focused on the epidemiology and prevention of emerging tobacco products, associations between media exposure and health, and the presence and spread of health-related information and misinformation on social media. So we're really fortunate that we have 3 speakers here today, and to have Beth Hoffman as a returning guest. She was here earlier this summer, and I'm excited that she's back with us again today. So Beth is a PhD student in the Department of Behavioral and Community Health Sciences here at Pitt Public Health, and a graduate student researcher at our Center for Social Dynamics and Community Health. Her research primarily focuses on the public health implications of the portrayal of health topics on popular TV programs. We love talking about TV programs, and I hope that we'll get a chance to do so today. And the spread of information and misinformation on social media. Her research examining the anti-vaccine movement on social media has been featured by multiple news outlets, including CNN, the New York Times, and then in this past February, a documentary on the Hulu streaming service. So I'm really excited about all 3 speakers. I'll now turn it over to Mike to start our conversation about the ways that the public health can address dis and misinformation in the era of COVID-19. So Mike, if I stop sharing my screen, I'll go ahead and turn it over to you. Thanks.
Great. Hopefully everybody can hear me okay. Thank you so much for the opportunity to talk today. This is an exciting group, and I go first mainly as a starting and opening act for the real talent here of Beth and Jaime. And what I really want to accomplish is sort of set the scene for generally how we've been looking at dis and misinformation across issues and not simply just at COVID. And then hopefully we can have a conversation about how it will impact, and it has impacted and it continues to impact both public health and well-being, in the U.S. and abroad, and the state of information. And if I want to leave you with sort of one takeaway message from this short start and short talk, is that our work is rather alarmist on this area. And that what we find is that the social media landscape in a particular way, that data valence fuels dis and misinformation, and we can't really separate dis and misinformation neatly in practice. But that the surveillance platforms on social media are very, very important vectors of worry and concern about an informed public and how we need to do better. I promised to lay out some of the terms that I think we'll be using throughout this conversation in this panel. So disinformation is generally defined as the knowing spread of false and misleading information, in contrast to misinformation, which can be the unknowing spread of false or misleading information. As you can imagine, they go together, right? So a successful disinformation campaign leads to other people being unknowing propagators of that disinformation through misinformation. Other terms that are used, and maybe we'll have a chance to talk about: propaganda, which is an authority passing self-serving information that could be mis or disinformation along. And then we've all heard much talk about fake news, which doesn't really have a pretty good definition, but you can think about it as a media authority passing information that is not true as one definition, but that gets twisted and moved around. And in some ways, this whole topic of mis and disinformation, right, in some ways is a hall of mirrors, because we're often talking about like what is true and what is false and from what perspectives. And there's this sort of quantum element to like, who's the observer and who's the measure and what's the state of information of all these things. And I'm a bit of a weirdo on many dimensions, but particularly in political science. So political science and social scientists tend to downplay the worry and concern about dis and misinformation, because we know from almost like a generation of work how hard it is to change people's minds. That persuasion is really, really difficult because people have priors and people are stubborn. I was very frustrated with this work over the last several years in studying social media and trust and beliefs. And so John Woon, who's also here at Pitt in political science, and a graduate student, Minsu Zhang, like we began creating agent-based models of experts and adversaries and citizens with different processing power, passing messages on different forms of social media. John runs experiments about trust and how easy it is to mislead someone and then guide them back. And important to this was the idea that maybe political scientists had this the wrong way out. And in some sense, we were looking at the problem inside out, and there's been a lot of traction in getting it right side in, which is that we often have to persuade people that these priors are working against public health experts. They're working against the useful new information, that what we have is a rugged, changing landscape of truth and reality that we're all navigating at all times, and we're searching for paths through. And it's very important for experts and people that are sort of ahead of us or have higher ground or have knowledge to be able to communicate. And so this is known as social learning throughout these communities. And so that's what we started modeling is, how can experts communicate their knowledge, right, to citizens when there are adversaries around that might want to block that transmission. And the findings from that are kind of scary. And they really cut through some of the myths of mis and disinformation in the literature. And so I'll just sort of walk through these three myths, and I'll debunk each relative to what our research has shown so far. So generally, when you see people say misinformation or disinformation is no big deal, they're talking about the messages, and they're measuring messages. In our simulations, right, actually dis and misinformation isn't about the messages at all. It's about the distribution of beliefs in people's heads, right? That's where the information is that has effects on beliefs, whether people are going to take a vaccine, whether they're going to wear a mask. It's not in the message, right? It's in their head and what they do, right? They condition their beliefs on the messages they see, but that's not the whole kit and caboodle. And very importantly, right, this is actually how disinformation transitions into misinformation, because it influences what's in people's heads, and then it propagates even further beyond the adversaries. Another myth that political scientists have and social scientists have perpetuated in this is that, dis and misinformation is actually about advertising. It's about individual persuasion. So they talk about campaigns and the difficulty of campaigning and other things. And so they kind of think that this is all about getting people to a point where they want to take a vaccine or take some specific action. But when you're looking at experts attempting to communicate in an environment where there are people disrupting that signal, this is known as the jamming literature, that what's out there is actually the problem is it's not about individual persuasion. The problem is how easy it is to jam persuasion and messages from experts to citizens. Because if you know where people are, and I'll get to that in the first place, you can send people incoherent different messages that their prior sort of want to believe, and you can pull the public apart in different directions with different messages. And so it turns out to be in these models much, much easier to repulse, disrupt, and jam expert communication than it is to persuade people of a particular point. So think about these as vectors, right? Pushing away from a point where we might want to get people to. And so obviously this has a role in, like, polarization has a role in how we think about this, and other things. The other myth is, generally about the effectiveness of this. So a lot of literature on propaganda and disinformation, right, comes from the idea that propaganda campaigns, and think about leaflet drops, kind of this idea of analog propaganda being passed to people, and the findings over 50 years that it wasn't very effective, that it didn't really do very much despite what happened. And one of the interesting things that our model identifies that's different. So if you drop messages, everyone's kind of seeing the same messages, or you're not. What you can think about is you're dropping a bunch of messages, but you're not targeting the messages to specific groups within the population that you might be trying to disrupt. What our model shows is if you just have some relatively coarse information. So we give our adversaries in the model, we give them little machine learning tools. And what they can do is basically do the equivalent of scraping information on the public, so they can cluster people into groups. They can pick out the identities that people hold to, and then they can tailor, again, coarsely, it doesn't have to be very fine-grained, messages to those groups that can be incoherent and push people in different directions. And so the idea is, if you know people's prior beliefs, the messages that they're susceptible to, and you can win by sort of keeping them where they are, like, don't take the vaccine, don't trust this, you haven't worn a mask, don't wear a mask in the future, right? That's an uphill battle, right? Combating those things. If you're just going for leaflet drop persuasion, that this is a kind of unequal battle between these two. So you can think about it as, when you can target this, data surveillance is one way this is known, that we're all leaving digital traces out there. And what they do is they allow people to know kind of where our persuasive points were, not necessarily to move us, but to keep us, from what might be a behavioral change that is necessary that we can think of. So again, this is data valence. And so this is kind of the scariest part of our model. That when we give adversaries, right, so very small numbers of agents that are interested in disinformation, but then that gets spread by misinformation. If we don't really give them a surveillance capability where they can't scrape and know about people, right, the blue on one side, these are different dimensions of policy preferences and the outcome. Basically, people, like, they can't do much. But if you actually allow them to, like, to know where people are, to surveil what types of groups you belong to, who else you're following, these kinds of things, what happens is the sort of tannish, you get to polarize. You can pull in different directions, or at least you can keep people in specific places while others move, which also leads to polarization. And so these three things together, I think, define the challenge of misinformation when we're in an information environment where things are changing rapidly, when the stakes are incredibly high, but we're on social media a lot, and having these types of interactions and connections that we need to be aware of. So I'll stop there. As a sort of survey of our work, hopefully we can have a longer discussion about it. And I think my time is just about up. Thanks.
Actually, perfect timing. So Jaime, I think you're going to go next. If you want to go ahead and share your slides, please.
Sure.
Thanks, Mike.
All right. You see them? We're good to go? Awesome.
Yes. You're good.
All right. All right. Well, thank you, Jesse, for having us here to speak today about how misinformation and disinformation fit into the puzzle of vaccine hesitancy, which is really going to be important as we prepare for the eventual approval and distribution of likely multiple COVID-19 vaccines. And thanks, Mike, for doing such an excellent job kind of teeing us up on this conversation. So first, I'd like to touch on the infodemic that we're seeing when it comes to COVID-19. And the term infodemic comes from the combination of two terms, information and epidemic. And this is exactly what it is. It's the rapid spread of both true and false information. And it spreads much like a typical epidemic, so quickly from person to person until it's pretty far reaching. The term was first coined in 2003, but it's been brought back into fashion more recently when the World Health Organization recognized that this is what's happening with COVID-19. And sometimes it seems like the information or misinformation about COVID-19 is actually spreading more quickly than COVID-19 is itself. And one reason that we might be seeing this infodemic is that this is the first pandemic that in the age of widespread social media use. So while only about 35% of US adults use social media during the 2009 H1N1 pandemic, today the vast majority of US adults use at least one social media platform, with Facebook and YouTube being among the most popular. And so looking back over the past year, 9 months, I don't even know how long it's been, it's easy to see why we have an infodemic. Public health messages have been changing over a short period of time due to the newness of the disease and also the rapid increase in knowledge about COVID-19. So for example, up on the top left, a popular message in the beginning of the year was that we should be more concerned about the flu in the US than COVID-19. And this was true at the time. But this message eventually morphed into the untrue belief that COVID-19 is not serious at all and we shouldn't be concerned about it. And that's something that we're still seeing today on social media. Another example in the middle is masking. So as the pandemic hit the US, the CDC recommendation that was that the only people that should wear a face mask were those who were experiencing symptoms of COVID-19 or those who were taking care of them. And this message, the message was that the general public did not need to wear a mask. And this was partially due to the lack of PPE for healthcare providers. And these recommendations did change as we learned more about asymptomatic spread and as we built up PPE supplies. But unfortunately, this is now used as evidence of incompetence of medical and public health professionals and that we shouldn't be trusted. And this is also something that we're still seeing on social media today. On the bottom, another prevalent COVID-19 misinformation category is conspiracy theories. Sometimes it's related to causes, like the virus being engineered in a lab. Sometimes it's related to spread. Sometimes it's related to cures. But a lot of the times this comes from research or theories that are put out on social media and is picked up by the news media before they're proven or fully studied. And a lot of the times these headlines are very attention grabbing and spread through social media quite quickly. So unfortunately, we have seen that the infodemic is starting to intertwine with a potential COVID-19 vaccine and with vaccine hesitancy. So a quick definition, in 2014, the World Health Organization defined vaccine hesitancy as the delay in acceptance or refusal of vaccines despite availability of vaccine services. And there are many different factors that contribute to vaccine hesitancy, but one of them is confidence in the vaccine itself and in the vaccine development process. So in other words, some level of trust. In 2019, the World Health Organization named vaccine hesitancy as a top 10 threat to global health. And this is along with other threats such as climate change and antimicrobial resistance. And the impacts of vaccine hesitancy can be seen through vaccination rates for other vaccines. So for example, currently MMR vaccine rates in the UK and the US have decreased to the point that they're now below the WHO recommended threshold for herd immunity. And it's important to note here that we're not just talking about people who are quote unquote anti-vax or part of the anti-vaccination movement. They make up about 3% of the population. Those who are vaccine hesitant, so those who are on the fence, are a much larger subset of the population, and they also might be more intervenable. So vaccine hesitancy in the US is not a new concept. As you can see up on the left in the Gallup polls from 2001 until last year, parental acceptance toward vaccinating their children has been on the decline. And this does hold for a number of different sociodemographic factors. Also in 2019, 46% of parents polled indicated that they were unsure whether certain vaccines caused autism. And we've also seen an increase in non-medical exemptions for vaccines in kindergarten across the US, and this is on the bottom of the screen. So in this study, in the 18 states that have allowed this allowance, the number of non-medical exemptions has increased in 12 states since 2009. And of course, the decrease in vaccination can lead to increased infections. So looking at the examples of measles, we can see that cases last year in the US were the highest ever since 2010. And the majority of these cases were in individuals that were not vaccinated against measles. And then these increased infections can lead to increased deaths. So this is a headline from yesterday's New York Times describing results of a report released yesterday by the WHO and CDC, which found that the global death tally for measles in 2019 was over 200,000, which is 50% higher than in 2016. And experts noticed that the increased deaths are due to insufficient coverage to achieve herd immunity in recent years. And they also expressed a concern that decreased childhood immunization rates because of COVID-19 are only going to worsen the problem. So globally, 26 countries had to suspend vaccination campaigns because of the pandemic, and measles outbreaks have already occurred in at least half of them. So this brings us to the COVID-19 vaccine. And a potential vaccine has been in the media since the beginning of the pandemic. And earlier in the pandemic, headlines seemed pretty positive toward the vaccine, indicating that many Americans would be accepting. But that started to change as the vaccine became more of a reality. So a number of different surveys have looked into COVID-19 vaccine acceptance. One study was published in Nature Medicine about a month ago, and it asked about 13,000 respondents around the globe in June 2020 about their acceptance of an eventual COVID-19 vaccine. And this graph represents the percentage of people from each of the surveyed countries that answered positively to the question, if a COVID-19 vaccine is proven safe and effective and is available, I will take it. And as you can see, the US was around 75% and was actually among one of the higher groups. So we do have to take this result with a little grain of salt, as the question presented the vaccine as safe, effective, and available. And the authors also stated that respondents that reported trusting their government had higher levels of vaccine acceptance. And they did note that trust in the government and vaccine acceptance in the US has been on the decline since they collected this data. So looking at some national surveys here in the United States, one of the earliest national surveys was in May, so a while ago, when many Americans were still in some variation of restriction or lockdown and were probably ready for the pandemic to be over. And the major findings here were that about 50% of US adults surveyed reported planning to get vaccinated against COVID-19. And there was some variance depending on sociodemographic group and personal factors. I did want to note, as you can see in the middle of the graphic, Black and Hispanic individuals reported lower levels of acceptance compared to white individuals. And some of this, a lot of it maybe is likely to do with the distrust in the medical and public health communities, which is going to be a really difficult barrier to overcome as the vaccine becomes available, and is going to require a significant amount of trust building in these communities and collaborations with community leaders. The researchers also explored the reasons for hesitancy among the respondents. So for here, the top two reasons were being concerned about the side effects and also being concerned about actually getting COVID-19 from the vaccine. Interestingly, the next three reasons demonstrated either anti-vax sentiment, so not thinking the vaccines work well, or not thinking that COVID-19 is serious in the first place. Okay, so how have things changed? So Pew Research Center conducted two surveys, one in May and one in September. And looking all the way to the left in the green, in May, about 70% of US adults were somewhat accepting of the vaccine, with about 40% indicating that they would definitely get it. However, 4 months later, again in September, the percentage who indicated that they would definitely get the COVID-19 vaccine shrank by half. Conversely, on the flip side, the percentage of US adults who probably or definitely would not get the vaccine grew pretty substantially. And again, looking at those reasons for hesitancy, there are two of the same reasons: concern about the side effects and not thinking that they need the vaccine. However, we do see two new concerns. So first, almost all respondents indicated they wanted to know more about how well the vaccine works. Also, about 1/3 of respondents were concerned about a high cost for the vaccine. And another interesting finding looks at trust in the vaccine development process itself. So according to the September survey, about 65% of respondents indicated having at least some trust in the process for developing a safe and effective COVID-19 vaccine. However, there are clear differences when you look at this between those who would get the vaccine and those who would not, with those who would not having much less trust in the process itself. Okay, so I think my time is up and I'm going to turn this over to Beth, and she's going to explore some different strategies for addressing the infodemic, especially as it relates to the COVID-19 vaccine. All right, Beth.
Thank you so much, Jaime, and thank you all for tuning in on this Friday the 13th. Before moving into some action steps we can all take to address growing COVID-19 vaccine hesitancy, I want to first discuss some of the history of the anti-vaccination movement and vaccine hesitancy, as I believe it offers us a number of important lessons to think about moving forward. When most people think of the anti-vaccine movement, the first thing that comes to mind is autism and the MMR vaccine, sparked by Andrew Wakefield's retracted Lancet paper from 1999 and the subsequent activism of celebrities such as Jenny McCarthy. Some may also be familiar with Andrew Wakefield's 2016 documentary Vaxxed, which traveled all over the US. However, the anti-vaccine movement actually begins with opposition to variolation, which was a precursor to vaccination. Variolation is thought to have been practiced in China as early as the 11th century, and in the 1700s reached both Europe and the American colonies. When a smallpox outbreak began in Boston in 1721, the Reverend Cotton Mather, also known for being a leader of the Salem witch trials, but in this case, a good guy, reached out to the medical community about variolation. Only one doctor was on board, and the practice was opposed by many physicians and others in the community. In fact, James Franklin, Ben Franklin's older brother, launched the New England Courant, perhaps the earliest tabloid, mostly devoted to amplifying opposition to variolation. And here on the right is a picture of an article from the Courant highlighting the belief that variolation was unnatural and unlawful. Opponents of variolation also cited concerns about Eastern medicine and safety. Ultimately, resistance quieted, both from Mather and Boylston's statistical analyses and also personal stories like the death of Ben Franklin's son from smallpox. Moving forward to 1796 and the development of the smallpox vaccine, at first, most people were very accepting of the vaccine, including Thomas Jefferson mandating Lewis and Clark receive it before traveling westward. However, in the latter half of the 1800s, organized opposition in the form of anti-vaccination leagues began in both Great Britain and the US, mostly in response either to new laws mandating smallpox vaccination or increased efforts to enforce existing laws. They were successful in prompting repeal or modification of some laws, although in the early 1900s, 2 Supreme Court cases affirmed the constitutionality of mandatory vaccination laws, which quieted political advocacy. Shown here is a picture developed by anti-smallpox vaccine activists from a news magazine in the late 1800s. Titled "The Vaccination Monster," it shows horned medical professionals literally putting children into the jaws of danger. You may ask, why am I talking about smallpox and showing you a picture from an 1800 newspaper in a discussion on COVID-19 vaccine hesitancy? And I would make the argument that what we're seeing on social media today is very similar to these anti-vaccine images from past centuries. To further illustrate this, here's the text, Jaime, if you could click, from a message that an anti-variolator attached to a grenade and launched through Cotton Mather's window back in 1721. And at 80 characters, it could be a tweet today on Twitter. And so thus, I would argue that the rise of the anti-vaccine movement is not the result of social media, but rather social media is amplifying these centuries-old arguments and techniques. So in other words, even if social media companies were to all of a sudden stop allowing people to post anti-vaccine content, public health would still need to be focused on addressing anti-COVID-19 vaccine sentiment and vaccine hesitancy more broadly. Additionally, as we look ahead towards the rollout and mass distribution of a COVID-19 vaccine or vaccines, it's important to remember, acknowledge, and learn from past instances where vaccine manufacturing did not go as planned. When doing my research on anti-vaccine sentiment on Facebook, I saw numerous people who are anti-vaccine reference the Qatar incident. And briefly, this incident refers to when 2 weeks after mass vaccination with the Salk polio vaccine began in 1955, 5 children, all of whom received a vaccine produced at Qatar laboratories, became paralyzed. It was determined that the virus had not been properly inactivated in this batch, and although the vaccine was immediately recalled, 380,000 individuals had already been vaccinated, and ultimately 94 of these people and 166 of their close contacts developed polio. Of note, the response was swift and thorough, both the recall of that batch of vaccine and a press release from the Department of Health, Education, and Welfare. And due to high levels of fear about polio itself as well, polio vaccine rates continued to be high. And to me, this event helps illustrate the important role timely and empathetic communication can play in helping to maintain public trust in vaccines, even if there is an adverse event. Coming back to COVID-19, as this graph from a September report by the COVID-19 Consortium illustrates, people consider doctors and hospitals and scientists and researchers to be the most trusted when it comes to managing COVID-19. Thus, I would argue that as public health professionals, we have an opportunity and responsibility to leverage this trust to communicate with the public, both in person and on social media, around potential COVID-19 vaccines. Additionally, this framework from a recent article in the American Journal of Public Health highlights the parallels between the spread of information on social media and the spread of epidemic disease, including extending those parallels to thinking about how public health and medical professionals can use social media to inoculate the public against misinformation and even treat some of the harms of misinformation. When I presented here in May, I mentioned that one way we can think about doing this is to use the ABCs that Jaime and I, along with our colleague, Dr. Kar-Hai Chu, developed. And I'd like to revisit these now, but with a specific focus on addressing vaccine-related misinformation. So the A in our ABC is to be active on social media and use it to deliver clear, concise recommendations to our online networks. For example, as public health professionals, we can leverage our own online networks to link to or amplify COVID-19 vaccine information from reputable sources. On the left is a link to the United Nations Initiative Verified. And if you sign up at the website listed here, you will receive trusted information from the United Nations to share on social media and with loved ones. Their prepackaged content makes it very easy to post credible information. And on the right is a link to Join Shots Heard, a nonprofit here in Pittsburgh, started here in Pittsburgh, that among other things comes to the aid of people whose social media posts about vaccines attract unwanted attention from people who are anti-vaccine. And I just wanted to mention that here because I know many people worry about such unwanted attention when posting about vaccines. Next is to borrow from influencers. And the public health and medical communities are at a disadvantage in competing for attention and reach on social media. Although Dr. Jerome Adams, the US Surgeon General, has several 100,000 followers on Twitter, it's nothing compared to the actor Tom Hanks with over 16.5 million. Further illustrating how we can borrow from influencers when it comes to COVID-19 vaccine messaging, here's a quote from a New York Times article last month about COVID-19 vaccine hesitancy, where Dr. Heidi Larson, founder of the Vaccine Confidence Project, and her husband mentioned partnering with celebrities. Finally, the C in our ABC stands for Counteract Misinformation. When you see misinformation, counteract it with reputable sources. Additionally, take steps to minimize the chance of sharing misinformation yourself. On this slide is a link to the United Nations Take Care Before You Share campaign. This campaign acknowledges that right now, emotions, especially fear, are running high, making us all more vulnerable to sharing misinformation. So this campaign urges us to all pause before sharing information to check our emotions, the source, and the date of the information. Ultimately, the idea behind the Take Care Before You Share campaign is to encourage people to be media literate. Media literacy means learning how to access, analyze, evaluate, create, and act using all forms of communication. To put it more plainly, being media literate is learning how to evaluate what you see in the media. There's a lot to learn about media literacy, and Jaime and I could do a whole seminar just on that. But basically, it boils down to asking a bunch of questions. So looking at this debunked Facebook post on the right, who made this post that I'm seeing, and who was supposed to see it? If you were to investigate a little further, you would find that it was posted by an individual abroad who was not a healthcare professional and is a strong believer in alternative therapies such as steam. If you were to ask your healthcare provider, they could share with you that this advice is potentially harmful, as inhaling steam at high temperatures can damage the lungs. What is left out that might be important? We have no idea who this person's friend is, if they truly had COVID-19, and whether they did recover. It's all hearsay. And also, how might different people react? Well, someone who is very scared that they might have COVID-19 might be inclined to try this because they want to stay well. Finally, some other questions might be to ask when this post was made, as it could be sharing old, outdated, and disproven information. And this particular post was disproven many months ago. Also, there are no sources, so we can't verify the information. So with that, I'd like to finish up. Thank you very much, Jesse, for having us here today, and I'll stop there.
Thank you, Beth. So I'm going to invite our speakers to join me. I will try and fix my camera so I'm not sitting in the dark too. And I will also ask our audience to go ahead and start posting their questions in the Q&A. So I can help to moderate. But before we get there, I'm going to ask one question myself, right? So Beth, what you said about sort of our responsibility as public health professionals really struck a chord with me, right? It's very challenging to think about processing information ourselves and then sort of what's our roles and responsibilities. And I am just sort of thinking about what can we do in our own networks to help to stop the spread of misinformation. And I wonder if any one of you could address that, sort of recommendations beyond the ABCs of things we can do in our own networks. Maybe I'll ask Beth first, and then we'll see from others.
Sure. So I think one thing we can do is think of from several weeks ago when Mary Hawk talked about the principles of harm reduction and particularly humanism. And so remembering that people, that we're talking to are humans, and rather than, launching sort of into battle, if you will, asking, where did you see this? And, acknowledging that, asking those types of questions and acknowledging that if it truly is misinformation and not disinformation, they don't mean harm. And we're all just kind of doing our best to process a lot of information at once. So I think coming from that compassionate framework could be helpful.
Yeah, that's great. And there's a follow-up question here in the Q&A. Can we really hope to stop the rampant misinformation on social media by drowning it out, or shouldn't alternative routes be explored for engaging misinformation? And so I wonder, I don't know, Jaime or Mike, if you have a comment on that one.
I can go first to kind of jump on Beth's and then also hopefully also hit this. I mean, I find it important to make this information translatable, because I realize that the vast majority of people in my networks, especially on social media, don't have a strong grasp on science. They don't understand how to read studies, which of course we shouldn't expect them to. And so I've tried really hard to take that information that's out there and make it more digestible, and trying to make myself as you know, I guess kind of the health professional that people can go to, my friends on social media, and ask this information. Because I realize that this is a very scary thing. It has been all along. People are desperate for information. They'll seek out information that makes them feel a little bit better. So how can we kind of, I guess, address some of those fears and break it down into more bite-sized packaging? When it comes to the rampant spread on social media, I feel like we're always going to be fighting an uphill battle. I mean, social media platforms are just everywhere. They're constantly changing. I feel like every time I turn around, there's a new one. So I think it's just kind of this concept that Beth talked about of, you know, teaching people just to be a little bit more cognizant about what it is that they're seeing, really ask themselves those questions of, you know, why am I seeing this? What is this supposed to make me think? What is this supposed to make me do? And that way that can translate to different social media platforms. And I saw Mike like nodding, so I feel like he wants to say something now too.
I just wanted to agree. So I think all of those things are exactly right. And I don't know if anyone has interacted with like the ALDA Center for Scientific Communication. So they have these nice steps about how sort of experts can translate what is often technical language, right, to the communities that they need to speak to. And one of the most important lessons that they impart to people that sort of that they deal with is exactly what you're talking about, is like being a person, right? And like, you know, that you're a person, not just an expert, right? It's not the ivory tower or whatever, right? Like, you know, you have similar concerns and problems, right? So there's things that are shared. Another way to look at this is one of the things that's used against experts often, right, in these kinds of tilted battles is they're not like you. They're, you know, these doctors and experts, right? They don't share your concerns. They live in these big cities. They make money off of, right? And, you know, you need to deal with that and show people that that's not true. And it's easiest in your community, but by doing that in your own community, it reverberates out. And that creates friction, right, for the misinformation, and then can inject, right, and sort of propel the positive information further.
So I'm going to take that. So I think we talked a lot about what we can do, and there are a couple questions in here about what's the government's role in some of this. So in regulation of social media, there's a specific question about can mis and disinformation be legally regulated in light of the First Amendment? And then a broader question about what other things could the government do to stop the spread of misinformation. So I'm going to ask Mike if you can pick that one up first.
Sure. So I'll start with, I'm not a lawyer. So you should invite a lawyer, right, to talk about that, because it's really, those are all important questions. But, you know, what I have done is I have studied speech and the changing institutions of information in the US and other democracies. And what I can tell you is we're sort of in this weird place in the US now where we think speech means that like our message or someone who expects to send a message should reach anywhere. And that's not really traditionally what speech was. It was literally like I could say what I felt. It didn't mean that you had to hear it, or 1,000 people had to hear it, or 1,000,000 people had to hear it. And that was a privilege. Of those things, and different countries have very different laws and regulations about that. And this particularly comes down to how we think about the platforms, right, and their role of curation. So it's not just like what I can write, right, but it's also about what happens as the messages propagate at light speed through servers around the world, and what that means. And there has been in the past. We're kind of at a low ebb of regulation, but historically that's not always where we've been. With this. And I think this absolutely is a place where sort of technology surpassed the regulation. And I can tell you from studying sort of government and committees that they're swamped. Like it's hard. And they don't necessarily have the tools to come up with the best possible solution to this, but we need to. The infodemic is real. The changing media landscape that we're in is real, and it has real consequences. So I think there absolutely are things government can do, but it ain't easy. And, you know, and looking internationally is one place, because there are other democracies trying to solve very similar problems.
So the impact that this all has is something that's also come up here in another question, specifically around children and their exposure, right? So when I grew up, I did not have access to social media. It was not part of my world, right? I have learned to live with it now, but as children are becoming more and more exposed to technology, to all of this messaging, essentially, what impact will it have on their development? And the question here is specifically around it negatively affecting development. But I'm wondering, Jaime, if you could comment a little bit about sort of exposure to social media and the impact on health of adolescents and children generally, because I think that also drives people to make changes for how it's regulated if it's really affecting children, like for whatever reason that feels like when policy changes are more likely. So maybe Jaime, you can talk about that a little bit.
Yeah, and I am not an adolescent development specialist by any means, but our children are getting exposed to this constantly. And again, I think this, I maybe sound, like a broken record, but this is just going to be part of the reality. They're exposed to all forms of media, not just social media. And again, there's a new social media platform every time I turn around. My own 11-year-old wants to be on social media constantly, and it's a battle. I have to say that I've noticed, a lot of the school systems are trying to deal with this, and it's being taught in some of the computer science classes and things like that. Like, how do you navigate media? How do you navigate technology? How do you navigate the internet and social media? And so I'm hoping that is something that we can continue to put some investment in, because I think it's just a matter of teaching them how to live in this environment at this point, unfortunately.
Yeah, so it feels like there's a piece here for how that education around the health literacy, media literacy, that piece about how to navigate it. And then also the information piece specific to, in this case, we're talking about vaccines and COVID and sort of how that information spreads. So there's a question here about enlisting celebrities to speak about COVID issues to accomplish our goals, right? So this idea of given celebrities are held in high regard by the general population, what role have they played in, I guess it's twofold, right? This issue that Jaime just raised in terms of helping us all to figure out how to navigate it, but then specifically for this, specific to COVID related messaging. So why, the question says, why not, why haven't the public health systems officials engaged with celebrities more directly? Beth, I'm gonna turn this to you because I know you and I have talked about it a lot, but this piece of what role could celebrities, we've talked about government, we've talked about schools, we've talked about individuals, what role could celebrities play?
I think they can play a really powerful role, both, potentially negatively, but what we're talking about is in a positive manner. I think one way is through what we talked about with the borrowing from influencers. So for example, back in May, this campaign called Pass the Mic launched. And what that did is let people, like for example, Anthony Fauci, he took over Julia Roberts' social media accounts. So that wasn't necessarily having a celebrity broadcast information, but using their vast power and networks. I think it's appropriate to mention on today, which is World Kindness Day, and I'm wearing my cardigan in honor of Mr. Rogers, that we can invoke here in Pittsburgh some of that imagery of whether it's wearing a mask or getting a vaccine, of we're doing this to help keep not only ourselves safe but also our neighbors. And then finally, sorry, I could really talk about this all day, but I'll just give one more example. I've been really pleased in popular media, especially the shows that have come back this fall, at how they've addressed COVID. So Dr. Burke and I have talked at length about one of our favorite shows, This Is Us, which is having their characters exist in our world. And they've just shown them, you know, they're wearing masks when they go out, when they go to the doctors. This past week, two of the characters who are engaged, they were taking a walk together, and when, you know, a stranger got near them, they put a mask on. And then that character actually, one of the characters asked if they could take a socially distant selfie, which is a term I had never used, but I love it. I think it's a great way to, you know, be talking about social distancing with our, you know, with people's, you know, taking selfies. And there was also a scene where a character was asking, oh, should I wear this mask or this mask? And again, it was just sort of like, this is our normal life, and this is the world we live in right now. And so I think that can be really powerful at helping people to, you know, do things like wearing a mask, maybe, you know, accepting a vaccine. And so I hope that we'll continue to see examples like that.
Yeah, those are great. And I will say that I was very happy when I watched the season premiere that, you know, they were just wearing masks and that wasn't a big deal. And it was really just refreshing to see. Notable because, you know, it's now in our TV world too, right? That sometimes we use it for escape, but we couldn't get away from it. All right, so I have a couple other questions that have popped up, and one that is here, Mike, for you. Talks about after the Sandy Hook Elementary School shooting, the media worked hard to display a fear of individuals who were neurodivergent, and how public health officials can help educate adolescents and teens about media bias in the incidence of mass violence. So this has come up in a couple questions. This, you know, sort of, can we sort of think about how the messages are being relayed and how to interpret those? Can you comment on that?
A little bit. Yeah. So I think that's really interesting. You know, I think we know from behavioral research, you know, one of the things, if you can get messages in front of people, right, that are sort of interesting, that grab their attention because they're novel, right, in some ways, but they also connect, right? This is narratives, these are stories. This is why we like a lot of the shows, you know, that we like. And, you know, part of the trick is building a narrative that people buy into. They want to be in the story, but they stay in the story because they're surprised about what it is. So giving people sort of novel information that's not exactly what they thought of their biases, right, about certain people, given a caricature, right, or a cookie cutter, right, perspective on what is a human being, right, who is multidimensional, and you know, or a group of people, right, that is hyper, right, multidimensional across these things. Like, you know, I think that is possible and can be like very, very effective. It's tricky given all the things we've already talked about, though, right? Like, you can't fit that into a tweet, right, necessarily, but I can disrupt that, right, in a tweet with a caricature or a snide comment that breaks right down, right, that discussion, which is why I do think, you know, traditional media, investigative journalism, you know, engagement in these longer form, like, you know, documentaries, if you can reach people, right, through different media, I think is really potentially valuable in those ways. I wanted to go back also to the celebrity part, right? So I do think it's really important in connecting these things to think about like the sort of the structure of the networks, right, that the information and the messages are being conveyed on. And so the Fauci, right, taking over and being able to message through channels, right, of someone who's kind of a gatekeeper, right, for a lot of people, but not because they're a public health professional, is a really important, right? So our like model would say that's awesome, right? Like, if we could have health professionals be gatekeepers, right, in networks, this would all work so much better, right? And so actually doing that, at least temporarily when we have to, when the sirens are going off, is like, that would work pretty well, or that would work better than a lot of other solutions to what we're talking about, because it not only gets people the message, it gets them to follow, right? It changes the network, right? Because then that person picks up followers and becomes more of a an important node for information that's being passed around. And then that gets to complicating, right? One of the things that we've also found is when you have complicated beliefs, right, it's hard to pin you down. And so this is, I think, gets back to the original question too. So you're getting information from different sources because you're not just having one media ecosystem. You know, you think there's complexity, so you see complexity, right? And you can process that complexity in important ways, even about people that aren't necessarily like you, but you can share something with. And so I just think all those things are really, really important. And so as we get away from the caricatures, right, we can get more towards both humanizing and you know, just a fuller picture, I think, of what the question was getting at.
Yeah, I love all parts of that answer. The reminder that, you know, essentially we are all connected, right? And there are paths connecting us in many, many ways, right? And social media is one piece, but the other relationships that we have and sort of where we get information and how it flows, and who says what and how that translates, right? This is sort of what we can study in an effort to figure out how to do a little bit better job. And so that feeds into two things. We're getting towards the end of time, but I want to ask about. So there's a very specific question here, you know, that we are unprepared as public health academics and practitioners to address misinformation and disinformation. What specific education training needs are there that really should be addressed for public health professionals in order to more effectively address these issues, right? So the academic in me is like, well, there's ways that we can study it, right? But then I think the question is getting to the sort of in the moment, what can we do and what training might be needed? And maybe Beth, you can comment on that. Or Jaime, sorry, I just saw you on.
Doesn't matter.
Beth first.
I can go and then Jaime can go. I was going to say, yeah, Jaime unmuted, so I can. I think one thing is more specific training around how to communicate on social media. Here at Pitt Public Health, we have great health communication classes. But in, you know, other health professions, like in med school, nursing school, there's a lot of focus on one-to-one communication in the exam room, but not communication beyond that. And even in public health, we focused a lot on the ground communication. But I think if the infodemic has shown us, you know, really anything, is that if we are not as professionals on social media, other people will be on there to fill that void. And so that would sort of be my recommendation from a training perspective, is to have specific training. I mean, even myself, I mean, the adolescents I coach at gymnastics know how to use TikTok, but I don't. So things like that. Jaime, I'll turn it over to you.
Totally agree. And I also think, you know, just like health comm, risk comm kind of training, stuff like that. But also, you know, thinking about how your messages are going to be received by, you know, the general public. Like one of my pet peeves in the state of Pennsylvania was the red, yellow, green when it came to the opening, because in any other world, green means go. And so, you know, I don't think that was really clearly not intended with that messaging, but I really like President-elect Biden's dial example, which is, you know, this is going to be a dial, and sometimes we're going to have to dial things up and sometimes we're going to have to dial things down, and people understand that a little bit more. So I think just, you know, really giving some thought into, okay, this is the message I want to get out there. This makes sense in my head, but then how will the rest of the population receive that information?
So I could talk to you all forever. Mike, do you want to add something in there?
I guess so. Just as the outsider here, like I would say there are allies who have been fighting battles like this across different issues. And in academia, we tend to silo things, right? But the climate scientists, you know, that people talk about the efficacy or the lack of efficacy of torture and other like human rights issues, right, have been fighting misinformation and disinformation and have come up with interesting like publications and snapshots of what works and what doesn't work. And not all of that translates, right? But some of it does. And I think they're definitely allies in answering that question.
Yeah, which is a perfect place to wrap up. So I love how much we've had an opportunity to talk about how quickly the science is evolving and what that means for how information is getting shared and then misinformation, and how interconnected we all are. And I like landing and ending on sort of the team-based approach, that we also need to connect with each other and talk to each other and learn from each other. So that's a great reminder. I could go on, but sadly we are out of time. I really appreciate you three taking the time to come talk with us. My guess is that we'll want to come back and talk again in a couple months as we sort of move further into this pandemic, and also learn more about COVID vaccines as they become available and what we can do to help promote their use. But in the meantime, we need to keep distancing, washing our hands, and taking care of each other. So I just want to wrap up by saying thank you to everybody for participating. But I also want to take a moment, since this is our last seminar, to thank everyone who helped to make this happen. So a special thanks to Mike and Joe and Jill from our IT and Dean's office, events coordination, who have worked behind the scenes. We haven't seen them, you haven't gotten to see them, but they make everything run smoothly. So just in conclusion, right, Thanksgiving's around the corner. Please make safe choices. We really need to flatten the curve of the pandemic. Thank you all again for joining, and have a great evening. Thank you.
Thank you.
Thanks so much. Thanks, guys.
Thank you.
Thank you.